Welcome to Collegial Conversations with Diana Clark, the professional webinar series that offers clinical and personal perspectives on issues that are common, but often not talked about. Here is today's Collegial Conversation.
Thank you for joining Collegial Conversations with Diana Clark. Today's guest is Gabby Mahan. She is a licensed professional counselor and certified eating disorder specialist who specializes in treating adolescents and adults struggling with eating disorders, disordered eating, body dysmorphia, and other related issues. An eating disorder warrior herself, she understands the complexities of the illness and how life-altering it can be. Thank you so much for joining us today, Gabby, and I will kick it over to you and Diana.
Thank you, Alex. I appreciate it. And thank you for joining us today, Gabby. I really am fascinated by the term eating disorder warrior. So when you are identified as a warrior, what does that mean?
Oh man, it means so many things, but I think for me, it just means that I overcame something that took a lot of life out of me. I think eating disorders are so complex and they take so much away from all the incredible things that make us who we are because we're so hyper focused on our body and shrinking our shape and our size. And so I think for me, a warrior means like I overcame one of the hardest moments in my entire life. And I was able to come out on the other side and truly live such a beautiful, fulfilling life that I have now.
Right. Some people talk about survivor, but I love the idea of warrior because it implies not just that you came through the other side, but that you are a warrior sending the message out that people do recover.
Yeah. Exactly. 100%. I always tell my clients that at the end of the day, I know that a lot of people come to therapy and are like, how could you possibly understand what I'm going through? You know, this isn't something that you have any experience with. And I tell my clients, I've actually been on the other side. I've sat on that couch that you're sitting on and I've struggled in the way that you have. While I don't have the exact experience that you have because your experience is unique, I have struggled through the complexities and, you know, the depths of an eating disorder. So I can understand to some degree, like the mental toll and just the distraught and the stress and the anxiety and fill in the blank with all the emotions that you must be going through right now. And I think that helps people feel more seen and more validated and I think more comfortable in the therapy room.
I get that. Can you give us a few bullets or a little snapshot on your eating disorder since they are unique in many ways to people?
Yeah, so I was diagnosed with OSFED, which is other specified feeding eating disorder. So the way that I like to describe it to people that are not as familiar with eating disorders, it's I dabbled in a little bit of everything. So I didn't quite check off the boxes for anorexia, bulimia, or binge eating. I had a long history, you know, over 10 years of struggling with my eating disorder, and it was very up and down. I come from a background of Latin American. So my mother is Hispanic. My dad is actually American. So I grew up in a household where food was seen, I think, a little bit differently. There tended to be some focus on body shape and size. And I think I got a lot of mixed messaging from just the way that I was brought up and my parents having very different views on food and body shape and size. And then I also think just societally being in school and amongst my peers. And I just think for a very long time, it was something that I latched onto because I didn't want to deal with a lot of childhood trauma that I'd gone through and a lot of my hardships. It was just easier to latch onto something that was familiar, and that was my eating disorder. Thankfully, though, I did get the help that I needed, and I feel really, really steady in my recovery. I've been recovered for 5 years now, and I can't imagine ever going back. And I think when I recovered, I was finally in a place where I was just like, I want to get rid of this. I don't want to have this anymore. I want to be able to actually live a fulfilling life. And I know that I can't do that with an eating disorder.
Yeah, that's brave. It is brave because the things you are not looking at when you're looking at just food and diet and control and all of those things, there's a whole host of things that doesn't get examined.
Yeah,
And
absolutely.
when you say, I'm going to walk through that, you're saying, I'm going to examine those things too, right?
Oh yeah. I mean, I think it exposes so much vulnerability, right? And I think for a very long time, I was very scared of vulnerability, but I really have come to learn that vulnerability fosters so much connection. And I think it provides so much healing. And I think it's such a vital part of the recovery process.
That's great. Tell me a little bit about the difference between what eating disorders, disordered eating, all get lumped in the same sort of category. Can you do a little demystifying of that?
Yeah, for sure. So a lot of people ask this question. So the way that I like to describe the difference between an eating disorder and disordered eating is an eating disorder is something that comes straight out of the DSM, right? That is a mental health diagnosis. And you are either engaging in really maladaptive behaviors to the point where it is drastically affecting your functioning. Like it is, you are unable to function without engaging in XYZ behaviors to either shrink your body, change your body, whatever it may be. And it's very hard, right? And like I said, it impairs your functioning tremendously, and it's hard to live your day-to-day life. Versus disordered eating, it's not that drastic, right? So like, let's take it a couple notches down, and it's more of, okay, I don't have the healthiest relationship with food. I definitely have some disordered thoughts. So, maybe I have some moral attachment towards the food that I eat. I eat very clean sometimes. And then, I allow myself to have quote unquote cheat days. Like the language and the jargon you're using around food is probably not the healthiest. And it's very negatively or emotionally charged.
Diet culture charged, right?
Exactly. Very diet culture charged. And in eating disorders, it is very diet culture charged. But like I said, the difference is disordered eating isn't completely impairing your functioning and not allowing you to live your day-to-day life. And eating disorders, that is very much the case. Like this is my whole world. My brain space is fully occupied with how much I eat, when I should eat, whether I should get rid of this food, how it's affecting my body shape and size. Disordered eating is, okay, I'm dabbling in some of these behaviors. I'm getting curious. I don't have the healthiest relationship with food, but I haven't gone all the way to the extent of it is completely just like shattering my life and it's all I can think about.
Right. So it's disordered eating, and then there's body dysmorphia. Where does that fall in that spectrum of?
Yeah. So body dysmorphia, a lot of people that tend to have eating disorders have body dysmorphia. They're very comorbid. And so meaning that they happen at the same time. And it's very interesting because I think a lot of people think that body dysmorphia just means like, I don't like what my body looks like. And there's parts of that, there's elements of that for sure. But if you really actually take a deep dive into the DSM, which is the Diagnostic Manual for Mental Health Disorders, you'll see that body dysmorphia can actually mean you're super unhappy or dislike a specific body part. So people that are very ashamed or dislike their height. Like I've had a client come in and say, I feel so ashamed and guilty. I don't want to go out anywhere. I'm isolating because I feel like I'm way too tall for a female. Right. So it doesn't typically have to be, I dislike my whole body. It can be very specific to a body part. Right. And so whenever anybody is unhappy with their overall body and physical appearance, that's more, okay, we're struggling with body image issues. Body dysmorphia is more so there's a specific part of my body or a specific part of my whole being that I really, really don't like and I latch onto and causes some impaired in functioning.
So it becomes the focus, not necessarily what you eat.
Correct. Yeah.
Okay.
Correct. Mm-hmm.
Can you talk just a minute or two about levels of care? You talked about the difference between disordered eating,
Yes.
not impairing, but what are the levels of care for somebody struggling with an eating disorder whose life is falling apart?
Yeah, so there's quite a few levels of care. So I'll break it down as simply as I can. But basically, you start with the highest level of care, which is an inpatient facility. So you are typically in a hospital. You are in dire need of care. Your life is on the line, right? Typically, you need a feeding tube, things like that. The level under that is residential. Residential is where you are living in a home. So kind of think about it as like a sober home or like a group home, but for eating disorders. So you are getting 24/7 care and help, but you don't need all the care that a hospital would provide medically. You're a bit more stable, but you are still struggling and need that supervision. So you are in a home with other individuals that are struggling with an eating disorder and getting a full treatment team at your disposal. dietitian, therapist, medical doctor, nurse at times, and then you're getting supervised pretty much all the time. The level under that is PHP, which stands for Partial Hospitalization Program. And while it has the word hospital in the title, it actually doesn't take place in a hospital. You are in what I like to say is almost like a huge office with a ton of rooms in it. And it is designed to have a cafeteria where you eat your food. It has suites or rooms for group therapy. You have an individual therapist, a dietitian, a psychiatrist overseeing your medication. So pretty much, again, a full treatment team at your disposal, but you're not under 24/7 care because you are going home at the end of the day to sleep in your own bed at your home or wherever it is you're staying. And then the level under that is IOP. So that's intensive outpatient program. And that is where you go to that same facility that you would go to for partial hospitalization program, but you go less days. So you go about 3 days a week instead of 5 to 7 days a week. And then the very last level is outpatient program, which is outpatient therapy, which is what I do. So I typically see my clients once a week. They typically have discharged from one of these higher levels of care, and they are looking to work on body image issues. They're looking to maintain their recovery and figure out how to kind of get back and assimilate into real life outside of treatment.
And do you tend to work as a collaborative team? Does somebody still have a eating disorder medical team and an eating disorder psychiatry?
So typically I will work hand in hand with a dietitian, a registered dietitian that is overseeing their meal plan or overseeing their food intake. I will also be in contact with psychiatrists if they continue to take meds once they get to an outpatient level of care. And then typically they'll have a couple appointments with a medical doctor that specializes in eating disorders, but those are, a lot less than when they were being seen at a higher level of care. So maybe they'll check with their medical doctor once a month,
Yeah.
Yeah,
that makes sense. So what is the role? I know that psychiatric medications or other medications don't erase an eating disorder, but how do they aid in recovery?
Yeah. So the way that I like to describe medications to a lot of people, being myself a therapist who takes medication, I take anti-anxiety meds, and I feel like they help me a lot, being someone who has a lot of genetic anxiety, so a lot of history of anxiety in my family. The way that I like to describe it to people is it's a little helper, it's a booster to help you be able to take a step back and allow you to actually engage in the coping tools that you're working in therapy with, right? And so a lot of the times when someone is so overly anxious, for example, we'll use anxiety, they're so anxious, they're unable to kind of think clearly and be able to dip into that toolbox and be like, this is the coping tool I need to use. This is how I can bring myself down. I can kind of ground myself a bit more, right? And so that medication, it really allows you to be like, okay, let me think a little bit more clearly. Let me reach for those coping tools. Let me reach for that lifeline. Let me call a friend and allow myself to stabilize and become more grounded. And so it's just, I like to say it's like a booster. It's a helper. It's not going to make your issues dissipate. It's not like the magic pill that solves everything, but it can definitely help when your symptoms of whatever it is you're struggling with are exacerbated.
That's great to know. Thank you.
Yeah.
What didn't I ask you that you would like our audience to know? I'm going to finish on that question. What?
Yeah, I think that a lot of people think that eating disorders have a certain look. And I think that's why eating disorders fly under the radar so much and why they're so normalized. We live in a world where dieting is normalized. Everyone's on a diet. It's what everyone's talking about. And so it's a lot harder, I think, for people to spot when it becomes disordered, when it becomes an eating disorder, right? And when you're treading along the line of disordered eating, you're at a higher likelihood to develop a full-blown eating disorder. And unfortunately, dieting is one of the leading causes of eating disorders. That doesn't mean that if you've dieted before, you're going to have an eating disorder, but you're at a higher chance to develop one. And so I think a lot of people underestimate that the fact that eating disorders, like I said, do not have a look. They come in all shapes and sizes. They come from all cultural backgrounds, genders, races, all that kind of jazz. So I think it's really important for us to remember that you can't just look at someone and assume whether or not they might have an eating disorder. there's a lot that needs to be done. A full evaluation and looking at all the factors that go into that are really important, because I think more people would get the care that they truly need if people weren't just looking at someone and saying, for example, well, you look healthy, how could you have an eating disorder? It's like, well, what does healthy even look like? Because there's plenty of people that are very slim and in smaller bodies that are very unhealthy, right? And there's plenty of people that are maybe are larger bodies or not what society would deem as quote unquote ideal, that are perfectly healthy. So
Absolutely. Thank you for that reminder.
yeah, absolutely.
Gabby, I appreciate you taking this time today.
Thank you so much for having me. I really appreciate it. It's a great conversation to have.
Thank you.
Thank you.
Thank you for joining this webinar. Tune in to more webinars and sign up for our newsletter at o'connorpg.com.